Hi everyone, this is Michelle from the Snooze Clinic and welcome to another episode of Sleep Talk. Okay, sorry I'm a bit casual today because it's a public holiday. Actually, I'm wearing shorts below. Okay, so why am I in the clinic on a public holiday? Okay, let me explain. So a patient had requested for the delivery of his CPAP machine today before 1 p.m. So I've been in here since 9 a.m. trying to make arrangements for Grab Express to send him his machine. But at 10 o'clock or slightly past 10, he sent me a text message to say that he'd like to cancel the delivery for today because he has a mahjong game at 1 p.m. Yeah, so well, since I'm already here, I might as well make full use of my time here, make the most of it, yeah? Okay, so what are we going to look at today? Well, very often patients ask me, hey, which discipline does obstructive sleep apnea fall under? Like, why is it was my ENT who told me to get a sleep test done? And for my cousin, it was his cardiologist that actually suggested that he got a sleep test done. So, who actually manages obstructive sleep apnea? Well, I think there are a couple of disciplines that actively participate in the management of obstructive sleep apnea. So we're looking at your ENT, your respiratory physicians, your cardiologists, your neurologists, and yeah, let's not forget your dentist. So in today's episode, we've invited Ellis from OMIC, or Oral Maxillofacial and Implant Clinic, to tell us more about how their clinic or how Dr. Ng sees out patients who may have obstructive sleep apnea. What are the signs and symptoms they look out for? It's somewhat different from what we look out for because, like, for us, we use the stop bang, right, as a basic screening tool, but for the dental clinics, they look at things like your mouth dryness, they look at things like gingivitis or bruxism, something like that. Okay, so let's hear what she has to say.
Hello everyone.
Hi Alice.
Hello.
Okay Alice, we have seen quite a few patient referrals for CPAP therapy from dental clinics. Who meticulously identify their patients who present with signs and symptoms associated with obstructive sleep apnea. So the signs and symptoms dental clinics look out for are undoubtedly very different from what we look out for. Are you able to share with us what some of these signs and symptoms are?
Sure. Patients who snore and who have obstructive sleep apnea may have dry mouth as a result of mouth breathing. So dry mouth may manifest as dry or chapped lips, and this can be seen on the outside or inside of the mouth. Sometimes dry mouth presents as a glassy-looking palate. Even the tongue can suffer from dryness, which result in a copperstone appearance and redness. Candida, which is an overgrowth of the yeast in the mouth, may also be seen.
I think to many people, myself included, having a dry mouth is not exactly a huge cause for concern. Is there anything about dry mouth which we should be concerned about?
Dry mouth can increase the risk of gingivitis, which is gum disease, tooth decay, and mouth infections such as thrush. Cervical caries, which occurs at the neck of the tooth, if not addressed early, will result in chronic toothaches and nerve endings are affected, and may also cause increased sensitivity of the tooth. This will result in many visitations to the dentist. It is highly recommended to consult your dentist early to avoid the above problems.
Wow, that's quite a handful of problems stemming from dry mouth. So having a dry mouth as a result of mouth breathing may not be as harmless as I thought, I guess. Are there any other dental problems dentists look out for when identifying patients with obstructive sleep apnea?
Yes, like dental attrition is something else which is commonly seen in patients who are suffering from obstructive sleep apnea. Dental restrictions happens when biting surfaces of the teeth are worn out due to the friction caused by the teeth rubbing against each other, which is also known as bruxism. Many bruxers may not be aware of the link between bruxism and obstructive sleep apnea.
Yeah, that's actually quite true. I mean, I've heard of people, well, around me, my friends and all that, who will tell me about their teeth grinding at night. But I don't think any of them have actually linked it to perhaps having obstructive sleep apnea. Okay, so does having a dry mouth or teeth grinding necessarily warrant a sleep study to be done?
Not exactly. We will usually collect more information, such as whether the patient experienced excessive daytime sleepiness, tiredness, and perhaps lack of concentration or focus, before the doctors decide whether patient should be referred to have a sleep study done, or if the patient should be referred to an ENT specialist or further assessment.
Right, okay. Out of curiosity, is there really a way to measure mouth dryness, or is it eye power?
Oh yes. There is the evaluation scale called the Sherlock Holmes scale, which doctors use to rate the severity of the dryness and serve as a comparison for treatment.
Okay, that's good to know. Okay, before we end off today's episode, do you have any tips or home remedies to alleviate dry mouth, which you usually share with your patients? We occasionally have some patients who do experience dry mouth while using the CPAP.
Yes, there is few things that they can do, like drink water. If they like candies, they can start on sugar-free candies, rinsed with alcohol-free mouthwash for dry mouth, or they can purchase over-the-counter saliva replacement products. If the patient is a smoker, you can quit smoking. If you are a coffee drinker, you can opt for decaf.
That is quite a handful of useful tips, which we can learn from. Thanks so much for being here and for sharing with us these useful tips. Thanks once again, Alice.
Thank you.
Bye.
Bye.
Oh yes, so you probably noticed by now there was no video snippets. Well, Alice is camera shy. Yeah, so we didn't video her when she was answering our questions. Yeah. So, okay, stay tuned for our next episode where Dr. Ng with Dr. Ng Chi Han from OMIC, Oral Maxillofacial and Implant Clinic, will give an overview of what they do. Yeah? Okay, we'll see you soon. Bye!